A couple other things I want to highlight here. Tom is really going to talk about planning for cognitive and functional impairments. It's once we look at addiction in the brain and how it overlaps with mental health, you're going to see that there can be some significant cognitive deficits for our clients who are, assaulting their brain with harsh chemicals on a very regular basis. This also has some pretty significant attachments to being at risk for relapse, because when patients don't have a lot of education about why they're feeling the way they are, and how come after they've been clean for 4 or 5 months, they still have some pretty significant deficits. Tom's going to show you some slides where you see stopping drug use, sometimes our cognitive functioning gets a lot worse before it even gets better. And that can be a real frustration point for our clients. So helping them plan for those impairments is important. Providing access. You guys know that. That's already you. You guys are really the door that people are coming to. But importantly, completing a full assessment. The requirements of paperwork for all of us are pretty insane, I think it's safe to say. And it's really hard to do thorough work in this area. But it is important for treatment planning that the best paperwork and the best information that we have is important for treating our clients well.
And actually, as you'll see this afternoon, if you haven't already seen it, the new forms that have been developed specifically for the assessment of co-occurring disorders were really developed thoughtfully. We had the pleasure, Jim had the pleasure of consulting with VMH on those forms. They're actually really good. They're among the best forms that I've seen, and they're really clinically useful as well as just a way of collecting some information.
Yeah, I think you'll find that they, as Tom said, that they're really useful. A lot has been streamlined, so stuff has been taken out, some of the redundancies and a lot of the sort of busy checklist stuff, and the pieces that have been put in are hopefully gearing you toward intervention and treatment. And of course, in an ideal case scenario, integrated treatment involves psychopharmacology and treatment planning and review. And, the vision of fully integrated services is, in a best case scenario, we have clinicians who are trained to do both, and that treatment is handled in the same setting by clinicians who are knowledgeable about both disorders. It's not always easy to do. It's one of the goals of the mental health system is to better equip you folks so that your clients are being treated in-house more or as often as they can be. And this requires clinicians that are trained in a variety of things like psychopathology assessment and treatment strategies for both disorders. This goes back to this idea of recovery being long-term and in some cases slow-paced. It would be nice if these problems remitted overnight, but instead we often find that this is a very long-term process that we're engaged in. And Tom's going to teach you about some motivational interviewing. Importantly, too, 12-step groups really have been shown to be a pretty good predictor for long-term positive outcomes for those who are using substances. There was the MAP study. There's a study that was done at UCLA that was a 3-year follow-up of about 1,000 methamphetamine addicts. And one of the best predictors at the end of 3 years that people were still that were not using drugs, this was both biological measures, so urine samples as well as self-report, was their involvement in 12-step. And it wasn't just involvement in 12-step, it was more involvement meant better outcomes. So if you were a secretary at a meeting, the more meetings you went to were all very predictive of having better long-term outcomes. That's probably a proxy for more treatment time. So the longer one is engaged in this process, the better they do. Not all your clients will be amenable to 12-step programs, but certainly if you can engage them in some sort of long-term care, 12-step is really available. And of course, pharmacotherapies are utilized according to need. And of course, I mentioned issues of trauma, but sensitivity to all of these issues, if you weren't doing enough already. You have to be culturally competent. And just to get a sense of where you guys are at here, just to do a quick exercise. This is level of program capacity for you guys. Are you guys at beginning mental health? Intermediate mental health, meaning that you are COD capable, you have some co-occurring disorders programming? Or are you advanced? Do you have a lot of co-occurring disorders and dual diagnosed programs, patients, or are you guys a fully integrated site? Where do you see you guys here at Edelman?
We're pretty integrated. I mean, we
Okay.
have some significant programs in place.
Okay, so you guys have a fair amount of programs that are in place that are targeting that population.
What, I'm not, I mean,
We have a
yeah.
substance abuse counselor who runs groups. We have
Okay, so you have staff.
co-occurring disorders in the field.
We have
Okay.
two dual diagnosis programs.
Okay, and you have staff then that are like KDEX certified or something or whatever it is, addiction. Okay. Okay. Okay.
I would say most likely you're probably falling somewhere in the enhanced range, because in a fully integrated program, regardless of where the person is in the system, they'd be able to receive treatment for both disorders at the same time in that
Yeah.
context. And so most of your clinicians would be trained in treating both disorders adequately. I think as a system, we're a long way away from achieving that in most settings, and most programs are falling sort of in that enhanced range, and what we want to do is continually push toward that fully integrated service. Sure.
Yeah.
I work as a peer advocate, and I'm also in certified.
Oh, great, great. Right, so, okay, so there are some staff who have specialty knowledge in addiction on board. Great. Okay. Okay. What I'm going to do now is I'm going to turn it over to Tom. We have to do a little switching of the lavalier. And Tom is actually going to start taking you through the process of what it looks like to develop an addiction and how this happens in the context of mental health development and mental health symptoms.